Hi, everybody. I'm Michael Carrese, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. Today, we're going to learn about a set of traits, habits, and skills that many of our guests in medical education have touched on as being critically important for medical learners to develop, but we've yet to devote an entire conversation to them. And I'm speaking about soft skills, well-being, resilience, and stress management. We're joined today by Alicja Galazka, an esteemed professor at the University of Silesia, who has been working with med students, doctors, and other clinicians for years in these areas. Professor Galazka is a psychotherapist, psychologist, internationally licensed coach, and international master trainer of positive psychology, neuro-linguistic programming, and mindfulness. Among other activities and achievements, she's president of the International Coaching Institute in Poland, author of numerous articles and books published in Polish and English, and a regional advisor for Trinity College London in Poland. And thanks very much for joining us today, Professor.
Thank you very much for the invitation. It's great to be here.
So I'd like to start, as we always do, with our guests by learning more about them, and perhaps you can add to that brief sketch I gave you your credentials and tell us what first got you interested in psychology and psychotherapy.
Actually, the long story, but since I was a teenager, actually, I always had friends talking to me, so telling me their secrets, asking for some advice and help. And then when I was in secondary school, I belonged to some youth organizations where I usually was a team leader or something like that. So I always like listening and speaking to people. So I also loved English. So actually, I couldn't decide what to choose. So I studied both. And then I got a scholarship. I went to UK where I studied also drama, which also then I used it also, drama and theater. I got fascinated by it and I started to learn it and use it as a therapeutic and educational tool. And I think that psychotherapy, psychology is something everybody actually needs when you look closely at, especially nowadays. And yes, and then it allows me to be much closer to people. And I think I have the skill probably that I'm very open and make people feel comfortable.
So you come by all of these skills naturally, the skills that you are trying to impart to medical learners, it sounds like.
Sometimes you feel that you have some talents, natural talents. And as a young person, you really don't know what to do with that. But then I actually, it was like choosing between teaching and being a therapist, but I managed to combine both.
Are you still using drama and theater in your work?
Yeah, I do use drama and theater in my work also with medical students. I never call it drama and theater because it would scare them because they think that they would need some, acting skills. So I never do it. But then when we just do the workshops, in the end, I call it drama, and then I explain that we have many drama strategies and conventions, which are really very helpful because we can practice, rehearse different skills. And I think it's a fantastic tool for teaching empathy and many other social skills.
So you use it sort of as simulations?
Mm-hmm. Role-playing simulations, some narratives. There are many conventions which go much further than just role-playing or improvisation. Yeah, I practice something which I call process drama, which is very different from theater because in theater we are very much focused on the product, and in drama the process of being in a group, practicing skills, that's what is really important. So
yeah,
and it works really very well with medical doctors and doctors.
Yeah, no, you could see how that would be so relevant. Beyond that aspect, describe your work generally for us with medical learners and clinicians, and what attracts you to working with them?
Yes, actually, it's a very long story because I have been working with clinicians and medical doctors almost for more than 20 years. So I work at the university. I used to teach international students at the medical university in Katowice, but mainly I work in medical chambers because they organize lots of different workshops, seminars, trainings, and we did lots of grants, European grants was sponsored by EU or by ministries. So I managed to with the chief medical chamber, we managed to train actually a few thousand young doctors. They had like 5 days of psychological trainings and then 2 days of medical law training. And so that's the first thing. I do regular workshops and seminars for doctors in regional medical chambers. I also teach doctors who have just graduated from the university. Every semester, I have about 30 or 40 hours with them. There's a blog on psychologists, psychotherapy. So we talk about communication skills, about coping with stress, lots of different things. So because I have like 30 hours with them. I also work in hospitals where I teach practicing or just clinicians. Then we organize different workshops for them in the place where they work because sometimes it's easier. So I do some trainings for them. I do some work on postgraduate courses for medical staff. We did also some grants with hospital management where I did some seminars and workshops on new approach to leadership and medical system. And also this year we actually started a new program. It's like the package for start for young doctors in our regional medical chamber in Krakow, where it's something like MBA for doctors, I would say. It's a 1-year course where they learn some psychological stuff, but also a little bit about economy, finances, things like that. But mainly we focus on developing some communication skills, dealing with stress, this kind of of things. Yeah.
Do you find medical learners and physicians to be easier to work with, more challenging to work with than other types of professionals?
I think at the very beginning, it was a big challenge for me, to be honest, because, to be a doctor is something very important and is a profession of high status. So I was a little bit blocked how they, react to my classes, because some of them probably thought that why do they need any psychological or psychotherapeutic stuff? But now, after all these years, I do like it. And I think this is a very meaningful work and I have good contact with them. And especially during COVID, with the pandemic, I had lots of online webinars for them. Or we even created something like therapeutic group for doctors. So I was meeting with them every week. Everybody could join actually. And even now they tell how much they benefited from them and how much it helped them because we could talk about different fears, different situations, emotions. In Krakow, I have lots of trainings there. So there is a group of people who actually become like a group of friends because they come for all the trainings and workshops. So now it's different. But at the very beginning, it wasn't easy because sometimes, when people who come, I thought that they want to come. So because it wasn't obligatory. With students, it's different because, it's like obligatory subject. So sometimes, you have students who have not really very positive attitude to that. But generally, I think I have really good contact with students and also young doctors who have just graduated. So I always think that I try to push them and just open up. And yeah, so I do like it. I think it's really great.
Oh, that's great. I mentioned the term soft skills in the introduction, which is a very broad category. Which soft skills are most critical for doctors to master and why?
Yeah, a soft skill is like, huge actually concept. I think the first category it would be like the interpersonal skills. So everything connected with building relationships with patients, communication, and being able to listen properly, but also skills which allow them to work well in teams. Because I think working as a doctor means that you also have to be able to work in teams. So all these kind of things connected with working even in interdisciplinary teams, which is not very easy, and I think it's quite challenging for many doctors. The other thing is the intrapersonal skills, because I think they are all very connected, interconnected. So especially nowadays, I think medical students and also doctors, they need to be able to take care of themselves. So this intrapersonal skills is like being able resilience, psychological flexibility, like emotional agility, things which allow them to deal with lots of different emotions, with stress, with occupational burnout, and also things which allow them to work with patient and motivate patients. Because soft skills for me also mean that you are able to motivate your patient to enter the therapeutic process. So everything connected actually with emotional intelligence, more or less.
Yeah, there's a lot there. I'm curious about how you teach somebody to have more emotional agility than maybe they start with.
Mhm. Yeah, emotional agility is something actually we all need, especially that they have to deal with lots of different emotions of themselves, but also emotions of the patients. So we do trainings on emotional regulation, how to regulate your emotions. It's not easy. It usually takes time, and the training takes the whole day, or sometimes I do it a few times if it's organized for clinicians and practicing doctors at the university is different. So we learn how to recognize your emotions, also in your body, how to name them, accept them, and then take any action. So there are lots of different approaches to emotional agility, emotional flexibility. I think that one of the most efficient approach is acceptance and commitment therapy, which teaches us how to accept emotions, because very often doctors especially, they try to suppress what they feel. They suppress the emotions, which of course leads to stress and then lots of different somatic diseases. So I teach them how to accept the emotions, what to do with them, using different interventions, different techniques. And I figure with time, we are successful, because they even notice in their bodies how they change the approach to dealing and accepting the emotions.
Yeah, it does seem to be an occupational characteristic that doctors want to appear stoic and unbothered by what's happening and strong, right? Which can really open up a path to a lot of mental health problems because they don't talk to anybody about what's going on. They don't want to acknowledge that it's getting to them, the stress of the job. So this is very important work, it seems to me. And maybe I think came to more awareness developed around this problem during COVID because the stress was just so extreme.
Was just like, yes,
Yeah.
very high. They have to allow themselves to take care of their emotions, because I think this is the problem. Very often they neglect it because as some people think that, oh no, I'm dealing very well with everything. I can cope with that. And, so they don't realize even what they feel. It's funny, but sometimes during the seminars or lectures, when I ask them, how are you feeling right now? And some people have the problem to tell how they are feeling right now because they don't even have the vocabulary connected with emotions. Not only doctors, but it happens very often. I'm feeling well or bad. There's a range of different emotions. So also one of the element of this training is to teach them like a vocabulary connected with emotions, that we have a huge range of different emotions, and it's important to recognize them, to name them properly.
You talked about physicians being able to help motivate their patients to change behaviors. And this is a huge issue, obviously, because of the rates of chronic disease. And so much of that is connected to behavior and behavior change. And in the United States, at least, there's been kind of a movement to do motivational interviewing with patients, with the notion that the patient should actually be in charge of the agenda instead of the physician saying, okay, you need to do this. You ask them, what's most important to you? And let's start working on that. So what are just give me a couple of examples of how physicians can approach a patient to sort of develop that sort of a conversation and elicit maybe a better result.
Yeah, it's a very complicated thing and not easy for physicians. But I think, first of all, I think if you want to motivate the patient, you have to listen the patient properly. So you need to know the whole range of different factors which can cause the disease. So I'm also trying to promote the approach called narrative medicine. Narrative medicine takes into account not only the somatic factors, but also the social skills, the social background, demographic background, all this story, and the whole narrative of the patient. So if you listen to the patient, you can learn more, because sometimes the fact that the patient is not motivated is caused by things, but by factors which we are not aware of if you don't talk properly, if you don't listen. And then, as you actually mentioned, I teach them how to ask questions, how to very quickly actually diagnose the psychological profile of the patient, because it is really important how you ask the question. We have something which we call meta programs, like different thinking patterns, and the way you ask the question can also lead to different answers. So to ask proper questions. I also think that the patient needs to be in charge of the therapeutic process. So, but you need to give them the choice. So one of the elements also of the training on instant motivation is asking questions and giving choice. And sometimes you feel the something which we call like the reluctance of not entering the therapeutic process. So, but people are generally when don't like when somebody forces you to do something. Generally, not only patients. Yeah, when I tell you do this, you have to do this. There's like the reluctance in your body and your mind. So if you give you the choice, it's your choice. You can choose. Do you prefer that? Do you prefer that? And sometimes it's even like the illusionary choice, because you can tell, oh, would you prefer to come today or tomorrow? Would you prefer to take this medicine or that, even though they work equally well, they're the same, but just creating the situation of the choice somehow stimulates the intrinsic motivation. So you can motivate the person. But I think that really the most important thing from observation and practice, I think if the patient feels that he can trust the doctor, he's much more motivated. Yeah, because sometimes even this few first seconds of conversation can make a difference.
How do you establish trust
So that's-
quickly with a patient, do you think?
There are many non-verbal things even. Yes, if you talk to somebody, no, you have to keep the eye contact. You have to be open. I think even the tone you use when you speak with somebody, and you have to be really focused on the person. I think we live in times where people actually speak a lot, but they don't listen. Sometimes they listen, but they don't hear. So the patient needs to know that you really listen to him and you hear what he says. And as in many countries, especially in Poland, very often doctors have no time because there is a time limit, no enough people working in hospitals. So everything is done very quickly, which doesn't help much. So if the patient feels that you care about him and you look at him, sometimes he needs like 5 minutes to talk about completely different thing than the disease. And then you can open the space for the professional conversation.
Yeah, this is ringing true with what's happening in the States as well, as the time per appointment is very strictly regulated. And also the problem has been pointed out often that doctors, because of the rise of electronic health records, clinicians are distracted by looking at the computer and entering information into the computer and not making the kind of eye contact and connection that you're talking about.
Yes. And this is an important thing. I usually tell the doctors that we know that they have to look at the screen, the computer screen, but even if you have to do it, it's good to tell at the very beginning, excuse me, I will be asking questions, but I will be looking at the screen. Because if you inform the patient what you are doing, it's completely different when you will look at the computer and the patient feels completely neglected.
Right. Obviously, this is super important information and skills for physicians to have. Tell me what you think about current medical training programs and whether they adequately prepare doctors to meet the demands of the job that we're describing.
Yeah, I think that the training programs are getting better and better. And actually, each university decides what they want to teach the students. But still, in my opinion, there is not enough space for teaching and training students the psychological stuff, how to deal with their own stress, with the compassion fatigue, and lots of problems they are facing. And on the other hand, I think that the programs don't teach enough the technology stuff and how to deal with technology, how to use AI in doctors' work, because it's getting more and more popular. So I would add these elements to the programs to make it more important and to focus on them more. And also what we have already actually discussed, the building the relationships with the patient, because I think it's getting more and more important nowadays. And yes, we will have also a new generation patients who are completely different, and most patients, young patients, deal with or cope with anxiety problems. So the doctors need to be prepared also to deal with that. So more like also psychosomatic diseases, which are now very popular, and I think doctors should be prepared to deal with that too. And sometimes the patients don't even need the medical treatment in a somatic sense, but they need to be listened to, they need to be, talked to properly, and it can explain a lot. So these elements I think should be added. And also one more aspect which I think is very important, working in interdisciplinary teams, because the times have changed and doctors are not the only ones who deal with the patients at the moment. So they need to be able to really to work, cooperate with people from different disciplines, and just to go a little bit beyond the little company or teams they used to work in. So that's also important, I guess.
Yeah, no, those are all excellent points. So if you were going to try to convince the dean of a medical school to do what you're talking about and increase the amount of content in this area, what information could you share with them to convince them of the case? Are there studies that show that physicians who are equipped with these skills have better patient outcomes, for example?
Yes, I think there is lots of studies in British medical journal. There are lots of studies about the stress the professional doctors deal with, and how important it is to equip them with some psychological skills like resilience, like stress management, and things like that. Also, there is a research on using some psychological interventions which can be very helpful with working with stress, both not only doctors but also patients. So mindfulness, there's lots of research on using mindfulness in medical context. And I think there's a book about the anxious generation by, probably you know it, by Hyde Jonathan, which describes the anxious generation. And I think it could be actually the book for everyone who works with young people, because he explains how the Z generation, the young generation, is not prepared really for the reality, and how much anxiety they suffer from. So I think for doctors it can be also very useful to understand these sort of things. There's another research by, I think, Walker from 2021 on anxiety symptoms. So lots of things like that. And I think if the people responsible for preparing the curriculum are more aware of all these elements, I think it can be very helpful to reshape a little bit the programs and the curriculum for students.
So if you could redesign one aspect of medical training to improve doctors' well-being, what would that be?
I think I would add some really practical trainings, because sometimes when I work with my students, they have lots of theory, medical theory, but for me it's important to train them, to equip them with some practical skills. So probably it would be good to add, like, I don't know, compassion cultivation training, so they can learn how to be compassionate, not only towards patients, but also self-compassion, how to practice it, how to change their mindset. So that's important, and it's all connected with emotional regulation, which can be useful, and also mindfulness sessions. It's all very linked and correlated, but these elements, I think, would be very beneficial for students. So at some universities, as far as I know, they've already introduced this sort of trainings, and the results are absolutely stunning, because the burnout went down, and the students, because it was also done at the university for students, so their achievements were much better after like 8-week trainings on mindfulness, for instance, or compassion cultivation training. It was actually done at Stanford University, and it brought lots of good results.
So you mentioned teamwork before, and the growth of the need to be able to interact with colleagues, but also as I'm listening to you talk about the growing mental health issues with the patient population, I'm wondering if, there's a case to be made that psychologists should be embedded in medical teams to help support what you're talking about.
Yeah, I think actually, as I mentioned, that now we should teach the future doctors interdependency, and psychologists should be absolutely also included in teams. So, because first of all, they can support the doctors, organize maybe something like the support groups. In some hospitals, in some places, we have balance groups, that's the group where physicians can talk about the patients they deal with and so on. But sometimes it doesn't even have to be the balance group, but like something like the support group. I don't want to call it a therapeutic group, even though sometimes it's more like therapy than only support. But it would be very good if doctors could meet and talk, because sometimes, I don't know about your hospitals, but in our country, very often doctors tell me that they don't even have time to communicate with their colleagues. So such groups, and maybe if there was a psychologist or anybody who would help them to meet and talk, it would be very beneficial for them. But also psychologists could be very helpful for patients, because as we already said, very often they suffer from psychosomatic diseases, or they suffer from loneliness, which is like now a new disease we are facing. And many, especially elderly patients, they come to the doctors not only because they want some prescription, but they want to talk. So if we had a psychologist or somebody like that at the hospital, probably this person could help the patient to talk about different issues and just improve his mental well-being.
Well, I have to say, Professor, these are just such incredibly important issues, and you've given all of us a lot to think about, a lot of new information, a lot of new approaches to all of this, and we just really appreciate you taking the time to share your wisdom with us today.
Thank you for the invitation. It's really great that I could talk to you about that. Yeah, I think we should really try to redesign a little bit the medical education, because for a very long time, in many countries, being a doctor means to be intellectually, intelligent. But as all these things we have been discussing is are very much connected with emotional intelligence, with some skills, personal and interpersonal skills. And I think that because everything has been changing so rapidly and people need to have somebody to talk to, I really observe how lonely people are in hospitals, but also my patients, and just this small talk and giving somebody some time can make miracles.
Yeah, no, you're absolutely right. You're not going to get an argument from me on any of this. I completely agree. Again, thank you so much for your time. It's been a real pleasure to be with you.
Thank you very much. It's great to be here.
I'm Michael Carrese. Thanks for checking out today's show. And remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.